Good day, all of you. In this session, we are going to speak on OSCE station of PAP smear. It would be an added advantage to the viewers of RAA online, and we will be seeing today who are the women whom we have to screen for cervical cancer and what a PAP smear is, how do we read it, and what are the interpretations of a PAP smear. There are universal screening methods and methods in a low resource setting. Of the universal screening methods, you have the conventional PAP smear and the LBC in cytology. The LBC meaning a liquid based cytology where we use manual interpretation versus your automated screening, and so you could go ahead and we'll see that a little later, and we could do the HPV testing also. Methods in a low resource setting would be the Willi, VIA, VM and point of care testing, which also we will see in a couple of minutes. The conventional PAP smear, what would you do? How do you do that? It is done in a patient without any anesthesia. The patient comes to the outpatient department, you ask her to void and make her lie down in the lithotomy position, tell her that what you're going to do because we are not going to give any anesthesia, and you would put in a SIM speculum or a Cusco speculum, doesn't matter, whichever is available and to the convenience of the attending gynecologist, and once you put the speculum inside, you will see the cervix, and you could use the Ayer's spatula and go around 360 degrees all around, and that will sample the cells in the ectocervix. And the Ayer's spatula, though it's got a longer blade somewhere, could sample the endocervix. At times you may not get a sample of the endocervix, and that's exactly the idea why we need to use a cyto brush, because the brush could go inside and could sample the endocervix also. So what you could do is take the Ayer's spatula and the cyto brush, and those cells are smeared on a clean glass slide fixed in a 1:1 mixture of 95% ethanol and ether or a spray which is already available, and it is sent to the pathology department where the cytologist will stain using a Papanicolo stain, meaning which they would use eosin hematoxylin original stain, which Papanicolo used way back in 1905 along with Trout, and that method is probably still one of the best methods of screening for cervical cancer.